Yeah, I hope I am audible properly. So in the last YouTube session, we discussed about the implant sizes. This was last that we discussed that the different implant sizes and different sites that are recommended. In a maxillary, I told you the range between 3 to 4. 4 is the ideal size. In lateral, it was 3.5. Canine is approximately 4 or maybe 4.5 also. A premolar is generally 4 and a molar is generally 4.5 or 5, or even wider diameter of implants can be used if the length of implant is less. Please remember, a 0.5 mm increase in width of the implant increases the surface area of the implant by 12 to 15%. On the other hand, 1 mm increase in length of the implant increases the surface area of the implant just by 2 to 3%. It means the width of the implant is a more important criteria as compared to the length of the implant. Okay, so when you are using short implants, means the length is less, the width can be increased to increase the total surface area of the implant. Similarly, in mandible, see, most of the mandibular tooths are approximately of the same size of the mandibular teeth except the mandibular central incisor, which is smaller. So the recommended size for a mandibular central incisor is 3.5, lateral is again 3.5, and canine 4, premolar 4, approximately molar for 4.5 or 7. Now, the next important point that we have to discuss is torque. See, in implants, when we talk about anything regarding stability, we talk it in terms of torque. Whether it is the stability of the implant when you are placing it on the day of surgery in the bone, you need to understand how much torque you are achieving. Or otherwise, when you are tightening any components over your implant, how much tighten the component should be done over the implant is checked in torque. So generally, when you place implants, the stability of the implant should range in a value of 35 to 45 Newton centimeter. So please remember the value of torque is Newton centimeter. Okay, and the range is 35 to 40 Newton centimeter. More the torque when you are placing implant is not good. It means if you're placing an implant and you're getting excessive torque or excessive stability, so this is not good because it can lead to fractures in the bone and even lead to bone necrosis and implant failure. So a more torque is not good for the implant. It can lead to fractures in the bone and necrosis. Okay. So the desired torque is 35 to 45 Newton centimeter. Now this torque can be checked with a implant motor, that is your implant physiodispenser. Your physiodispenser has torque values from 5 Newton centimeter generally to 80 Newton centimeter. So depending upon how much value of torque the physiodispenser is showing, you will come to know that while placing your implant in the bone with the physiodispenser, how much torque have you achieved in your implant. The torque can also be checked with this type of instrument that is there in your surgical kit, that is known as a torque ratchet. So if you get this diagram in exam and they ask you what is it, it is a torque ratchet. It is used to check the torque of placement of your implant or the torque at which the component should be tightened over the implant. If more torque during implant placement, it can lead to fractures and tension and fracture in the bone. Now, next important point, and they ask a lot of questions regarding this. What is the drilling sequence? So they ask questions about which drill should be used first and which drill should be used later on. Then they also ask, can we skip the drill? Suppose This is a 5 mm diameter of drill, and I want to drill 5 mm. Okay, and I used my initial one or two drills and directly jumped to a 5 mm drill. So the disadvantage is, first of all, obviously, it will put a lot of pressure on the bone. The chances of bone necrosis is more. The second disadvantage is when you are suddenly increasing the osteotomy too much. So what happens? The bone can fracture, the drill can slip, and your osteotomy may not be formed properly. So it is not advisable that that you skip any drills. Okay. So drill, the first drill that we always use is known as a guide drill. उसको क्या बोलते हैं? Guide drill. The guide drill is very sharp at the tip. The advantage is when you place it on the bone, the drill will not slip and it will create a guide for the next drill to drill at a proper place. So इसलिए इसका नाम क्या हो गया? Guide drill. So आपको कोई भी drill एकदम sharp दिखे टिप से, it is known as a guide drill. Guide drill is also known as a lens drill. Guide drill is also known as a lens drill. It is also known as a Lindemann drill. It is also known as a Lindemann drill. So guide drill is also known as the lens drill or Lindemann drill. So all these are the first drill. So in case they give you a question in the exam, which of the following is the first drill when you drill your implant, when you do your implant surgery? First option guide drill, second option lens drill, third option Lindemann drill, fourth option all of the above. So answer would be all of the above. Okay. Now once you have drilled with your guide drill, the second drill is your pilot drill. The second drill is your pilot drill. The diameter of your pilot drill is approximately 2 millimeters. The diameter of your pilot drill is 2 millimeters. In some systems, the diameter is around 2.2 also. So, अगर आपको क्वेश्चन में 2 millimeters मिलता है, you will choose the best answer as 2 millimeters. Option में मिलता है 1.5, 2.2, 2.8, 3.5. Then answer would be 2.2. So my second drill is pilot drill. अब in all India में क्वेश्चन आया था, which is the first drill when you use it for your drilling. उसमें ऑप्शन थे number 1 pilot drill, number second option था 3 mm, number fourth option था, third option था 3.5, फिर था 4 mm. So obviously in this case the first drill would be the pilot drill. But अगर क्वेश्चन में lens drill या guide drill भी है, तो that would be the first drill. So please read the question and the options properly. Remember, the drilling sequence should not be skipped. Drill with subsequent sequential drills up to the last diameter of the implant. Suppose एक 4 mm diameter का implant डालना है, so your last drill should be 4 mm in diameter. Please remember that length हमेशा पूरी drill करनी पड़ेगी. Suppose if you want to place a 10 mm length of implant, you'll have to drill 10 mm in length. आपका implant bone में कट करके अंदर नहीं जाएगा. Remember, now when the bone is very soft, like in maxilla, so they can give you a question. Suppose a patient has D3 or D4 quality of bone. It means the bone is very soft. A patient has D3 or D4 quality of bone. What would be your drilling sequence? So if the bone is very soft, अब now suppose मेरी bone है D3, D4 बहुत soft है और मेरे को sorry एक 5 mm diameter का implant डालना है और मैंने क्या किया, एक 5 mm drill से 5 mm तक ही drill कर दिया and I want to place an implant of 5 mm. So obviously my osteotomy is 5 mm and I am placing an implant of 5 mm. I would not be able to achieve good primary stability. मुझे क्या नहीं मिलेगी? Primary stability. What is primary stability? Primary stability जो हम भी हमने बात करी थी torque. So primary stability is the torque achieved just after implant placement. it is very important that you need to have a good primary stability if you want your implant to be successful. ठीक है, अब soft bone है तो I need to under prepare in diameter my osteotomy. Suppose if I want to place an implant of 5 mm and I drill 4.5 mm, अच्छा इसका मतलब मेरा होल ऑस्टियोटमी कितने साइज का है 4.5 mm, और अब मैं इम्प्लांट डाल दूं 5 mm का, सो ऑब्वियसली द इम्प्लांट टू बोन कांटेक्ट विल इंक्रीज and my primary stability will also increase. So whenever you get a question where they say that the bone is very soft, will you over prepare your osteotomy, will you under prepare your osteotomy, will you prepare your osteotomy to the same diameter? Answer becomes will prepare your osteotomy less. Always remember, similarly in immediate implants, what do I mean by immediate implants? I extract and I place my implant at the same time of extraction. हमेशा आप अपनी ऑस्टियोटमी को 0.5 mm कम ड्रिल करोगे विड्थ में. ओके, सो दिस इज व्हाट यू फॉलो. सो पायलट ड्रिल के बाद नेक्स्ट ड्रिल इज 3.5, 4, 4.5, 5, 5.5 डिपेंडिंग अपॉन व्हाट diameter of implant you have to place. So this is the first drill, that is a guide drill. We'll take this drill, we'll put it in the implant motor. Implant motor को हम लोग क्या बोलते हैं? फिजियो डिस्पेंसर. फिजियो डिस्पेंसर, उसको हमने फिजियो डिस्पेंसर जो ड्रिल थी उसको हमने बोन पे रखा and we go in the bone. Now we take the drill out and we remove the drill from the handpiece. Now what do you see here in the image? They can ask you, this is a paralleling pin. Paralleling pin से आपको ये पता लगता है आपके drill का angle. If you are drilling in a wrong angle, you will just put this paralleling pin in the bone and you will come to know that the angle of your drilling is wrong. So it means you need to correct your angle while drilling. So what is the role of a paralleling pin? It helps you to check the angulation of your drilling. Now I will take my pilot drill of the length of the implant that I want to place. भाई ड्रिल का डायमीटर तो फिक्स है, बट लेंथ आपको जितने लेंथ का इम्प्लांट डालना है, you will go to the same length and you will go to the stopper and you will place the drill and you will come out. Similarly, you will remove the drill. Now I'll take my 3 mm drill, I'll go to the complete depth, and I'll take it out. Now I'll take the 3.5. Similarly, I'll do the complete steps without skipping any drills. I'll take a 4. In this way, I don't want to skip any drills and I'll continue drilling up to the last drill of the diameter of the implant. Okay. Now, so torque we have already discussed. अगर bone बहुत soft है, we will drill 0.5 maybe 1 mm less. Immediate implant है, I will drill again 0.5 or maybe 1 mm less. अब एक क्वेश्चन आपके पास आ सकता है, if you are placing your implant and you are placing your implant in the bone and you saw that the torque is high, torque ज़्यादा आ रहा है, and your implant is one or two threads of your implant is outside the bone, but the torque is already very high. So what should you do? So what you should do is you should take your implant clockwise. You should move your implant in a clockwise and anti-clockwise motion 5 to 6 times. So what will happen? The bone there will expand and that excessive torque will reduce to a torque that is within the limits. Okay, तो अगर क्वेश्चन आता है एक दो थ्रेड्स रह गए, टॉर्क बहुत ज्यादा आ रहा है, तो क्या करना है? Just don't remove the implant. You cannot just place the implant at the same torque. What you have to do is rotate your implant clockwise and anti-clockwise with your ratchet 4 to 5 times, and your torque will decrease because the bone will expand. Okay. Now, if you see this picture, now first thing that is done here is you see the distance mesiodistally to place the implant. Now mesiodistally, if suppose this space is coming out to be 10 millimeters, so they can give you numerical questions also. So suppose this distance is coming out to be 10 millimeters. So मैंने आपको बताया था implant to natural tooth 1.5 to 2 mm का space छोड़ना है. So 2 mm हमने mesially distally space छोड़ दिया. So 10 में से 4 mm हट गया. So how much space is left? 6 mm. So according to the mesiodistal space, the maximum diameter of implant that you can place is 6 mm. But to place that implant of 6 mm, you need to also see that how much is the buccopalatal width of the bone. So now I told you that you need at least 1.5 to 2 mm of bone on the buccal side and 1.5 mm of bone on the palatal side. So it means 3 mm की bone implant diameter के बाद भी होनी चाहिए. So at least if maximum mesiodistally I had the space of 6 mm, 6 plus अगर मुझे 3 mm की bone है 9 mm buccolingually, तो मैं 6 mm का implant डालूंगा. Otherwise I'll have to decrease the size of my implant. So suppose my buccolingual width is 7 mm. So I can maximum place an implant of 3 or maybe 3.5. So the size, the width of the implant depends upon how much is the mesiodistal space and how much is the buccolingual width. How much is the buccolingual width? Okay. Now once you have hold the blade in a modified pen grasp, you will first give this incision. Now they can ask you this question: what incision technique is this? So when you see your the incision, I have not cut the papillas here. So this is a papilla sparing incision. When you see in your incision, the papillas are not cut. So you can answer it. It's a papilla sparing incision. Okay. Now they can show you this picture. What is this first drill? This first drill is the lens drill. This first drill is the lens drill. So this is the first drill, that is a guide drill. Okay. Now once you have drilled with the lens drill or guide drill, okay, you'll take it out. Now what is this next drill? This is the pilot drill, 2.2 mm in diameter. So if you get this picture, please remember it is a pilot drill. You go to the complete depth, you take your drill out. Now this is your next drill, that's your 3 mm drill, and you'll go to the complete depth again and you will take it out. So what is necessary to understand that the length of your drilling is exactly to the complete length of your implant. The width depends upon the bone density. If the bone is hard, you will drill your implant to the same diameter. If the bone is soft, you will drill 0.5 to 1 mm less. Now this is your implant or fixture, also known as a fixture, and you will place it over the bone and you will place that implant in the bone. अगर आपको ये picture दिखती है, what is this? The implant driver. This implant driver is used to hold the implant and position the implant in the bone. अब हम लोग क्या कर रहे हैं? लास्ट के 2-3 threads रह गए. So I'll put those threads with my ratchet and also see the amount of torque that I have achieved. So what I have done, I put a driver over it and I put a ratchet or a ratchet. What is this? अगर ये diagram आपको देखने को मिलता है, this is a torque ratchet. This is a torque ratchet. So when you see this ratchet, this torque ratchet, जैसे ही this spring, you will pull this spring to the level the spring is pulled, उतना torque achieve हुआ है. So now looking at this, I can see मेरा ये spring 35 तक जा रहा है. I have achieved a torque of 35 Newton centimeter. तो अगर आपके पास क्वेश्चन आता है कि कितना टॉर्क अचीव हुआ है, तो आपको यहाँ देखना है, वैल्यू यहाँ पे लिखी रहती है, यहाँ पे नंबर है 10, 20, 30, 40. अगर ये 30 और 40 के बीच में आ रहा है, it means 35. So if you get a question like this, you can answer it in this way. और अगर वो सिंपली पूछ लेता है ये क्या डिवाइस है, this is a torque ratchet. Now I have placed a covered screw over my implant. इसमें हमने क्या किया? We placed a covered screw over the implant and we close the side. If I place a cover screw right now and I close the side, after 3 months, once my implant will osseointegrate, I will need to uncover my implant. Means मेरे को वापस से incision देना पड़ेगा और उस cover screw को हटा के मेरे को उसके ऊपर क्या लगाना पड़ेगा? Healing abutment or a healing cap. Healing abutment or a healing cap. Okay. So when अब क्वेश्चन नेक्स्ट डे पूछ सकते हैं, when do you do a one stage surgery or a two stage surgery? One stage surgery का मतलब healing implant डालते ही हमने उसके ऊपर क्या लगा दिया? Healing abutment. और two stage surgery का मतलब जो हमने अभी दिखाई थी, first you have placed a cover screw and after 3 months when your implant is osseointegrated, then we'll place a healing cap over hit. So one stage तब करना है जब stability अच्छी मिली है. Anything that has good stability more than 25-30 Newton centimeter, then you can do one stage. कहीं पे भी कोई बोन ग्राफ्टिंग नहीं हुई है, पेशेंट टोबैको च्यूअर नहीं है, स्मोकर नहीं है, कोई भी पेशेंट के सिस्टमिक कंडीशन अनकंट्रोल नहीं है, तब आप वन स्टेज कर सकते हो. मींस डायरेक्टली यू कैन प्लेस योर हीलिंग कैप. अदरवाइज यू विल ऑलवेज परफॉर्म अ टू स्टेज सर्जरी. सो अगर क्वेश्चन आता है व्हाट is the most important factor to decide that you can perform one stage or two stage, so it is primary stability. The primary stability should be more than 25 to 30 Newton centimeter. So where we place the cover screw first and a healing cup after 3 months, it's a two stage surgery. And where we directly place a healing cap over your implant, it's a one stage implant surgery. Okay. Now, after your drilling, there are two terminologies that you need to remember. What is peri-implantitis and what is peri-mucositis? So, peri-implantitis ideally is irreversible. It's more like periodontitis. In periodontitis also we know there is bone loss around the tooth. Similarly, peri-implantitis is with respect to the implants, whereas where there is bone loss around the implant. It is irreversible, means once that bone has resolved, you need to do some grafting, but it cannot come on its own. A perimucositis is like gingivitis. It is reversible. So it's like soft tissue inflammation. Like gingivitis, there is a plaque, the soft tissue gets inflamed around the tooth. Similarly, around your implant also, if your soft tissue, it gets inflamed, then this is known as perimucositis. So this is reversible. Okay. So we have finished the implant part. Next time we will be discussing about image based questions about instruments. So I'll be showing all the images of the instruments and we'll be discussing those images, and I'll be giving that PDF also to you. Okay. So you're done with the implants. Just go through all those videos to revise. If you have any problem in this, try to concise it as much as possible so that you can just solve your MCQs. Thank you so much.